The reason we're doing this video is to introduce you to our Epidural Suite, or where we do injections here in our office in Washington Township. Try to ease everybody's mind and give them an idea of what to expect when they come into the office. So the first thing you're going to see after you come in and get your blood pressure checked and vitals done is you're going to come into this room, which is what we call the Epidural Suite or the block suite. In the block suite, there will be two individuals, myself and an X-ray tech. We're the only ones that are in here during the injection. Also in here, obviously, we have our X-ray facility and the screen so we can visualize where we're doing the injection. Before we do anything, we're going to confirm that you are who you say you are and that we're doing the injection that is scheduled, and go over any questions that you may have. And I do generally will go over the procedure again with you before we do the actual injection. Now that we've confirmed who you say you are, we've gone over the procedure. For a typical injection, as far as a lower back injection, we're going to have you lay on the table on your stomach with a pillow underneath here. The thing you will feel during the procedure is this table will go up. Once it's up to a certain level, it will not go up and down until you're done with the injection. The other part of our imaging is what we call a C-arm, and it's called that because obviously the shape that it has, but that is the part of this that will move. It will either go above you or on the sides to give us the best and most accurate picture of where we want to do the injection. This is how we use this to give us the pinpoint precision that we need for these injections. Now, while I'm talking about the C-arm, the other thing you'll notice when you come in the room is that both myself and the X-ray tech have these nice things on that are basically lead to protect us from the X-ray. Well, the reason we have these is I do these every week, numerous injections a day for years and years and years. You're not being exposed to any significant amount of X-ray any more than the X-ray you got in the office before you came in here. But we wear these because we're in here on a more frequent basis there. So I always tell patients that just to reassure them that we're not using a significant amount of radiation in here. And to make it more scarier now is we have the masks on as well along with them. So again, this is the only part of the machine that will move during the procedure itself. So the reason we're doing this is I have many patients that I see that are anxious about the injections that we're doing, and I wanted to give them an idea of what to expect before they came in to try to help ease that. Then they would have an idea of what to expect here. When I see patients in the office before an injection, I always tell them that it's just like a regular patient visit. You'll come in, you'll check in the normal way. The only difference is we bring you back to do the injection. And more now we're doing most of our injections in the office. So going to the surgery center and having sedation and things like that aren't done nearly as much as they had been in the past, which is another reason why I like to kind of ease people into this, letting them know what we do in here to get everything set up. So at this point, once we bring you into this room, which is what we call a block suite, you've already been through check-in, you've already been evaluated by our nurse, had your vital signs, blood pressure, things like that already done. So we come in here, the first thing we do is confirm you are who you say you are and what the procedure is that we're actually doing. And again, just as we had in the visit before this, we'll go over the actual procedure that you're doing. Once that's done, I will explain to you, as I do to every patient, it actually takes us longer to get everything set up for this injection than it does to actually do the injection part. And once we're all done, most patients will say to me, that was it, we're done already, because they think it's going to be a long, drawn-out process, when it really isn't. You come in like a regular visit, you're here at the most a half hour, and it's usually not that long. So let me go back to once you come in the room, depending on the type of injection you have, will depend on the kind of position we will put you in on the table. If we're doing a regular lower back injection or an epidural injection, we usually will have you lay flat on your stomach with this pillow underneath there. We do them in this room because we have the X-ray availability. This is basically called a fluoroscopic X-ray that we use to find the position of the needle where we're going to do the injection. There's usually several different pictures that are done throughout the process, and you may notice that the X-ray camera will move around a little bit, or I may be talking to the X-ray tech during that time frame. The table usually will be at a certain height and it won't move from there, but the main part of this, which is called the C-arm, will turn around so we can get multiple views of where we want to do the injection, therefore being or I should say allowing us to localize the best spot for them. So once we have you laid down on your stomach, we have our, which is a standard epidural kit here. We will clean and prep your back with betadine. Once we do that, we'll drop the medications. We do that as well to allow the betadine time to dry. The patients, when we use the betadine, the worst thing is it's cold, and there's nothing I can do about that, and that usually gets people's attention more than anything else is that. When we do a standard injection, you're basically going to feel a pinch and burn from the numbing medication that we use. And the other thing you will feel is some pressure when we do the actual injection. Why that is because where we do the injection is a closed space, kind of like if you have a balloon, you put a needle in there, you get a release of pressure. It's the same kind of thing with the epidural space. So that's the biggest thing that people will tell me when we're doing injections is that they feel the pressure in their back or down their legs there. If you don't feel that pressure, doesn't mean the injection is going to work one way or not. It's just a sign that you're in the right space to a certain extent. When we do that there, before we do that part of it, we will give you some contrast to make sure we're in the right space as well with this. The whole procedure when we're doing the injection, again, takes about 5 minutes to do there. The biggest thing that patients have is, again, a little bit of the shock with the betadine and the pinch and burn from the lidocaine. But once we give you the lidocaine, that tends to numb the area pretty good. So I always tell patients this both before the injection, in the office visit, and then when they come in for the actual injection, that you're not going to have any severe horrifying pain with this injection. That's not what to expect. And anybody that's telling you that, that's not what you should believe as far as that goes. Once we're done with the injection, we have you sit up gradually, and then what we do is take you back to recovery. You hang out there for about 5 to 10 minutes. Once we make sure you have good feeling in your legs, then you're able to go there. With each procedure we do here at Rothman, it is a requirement for our department you have to have a driver. And that's for not only your safety, but everybody else's safety as well, as far as that goes. You always will leave here with a follow-up visit for approximately 2 to 3 weeks after the injection, so as we can evaluate where we are and see where we need to go. The other thing that I feel I say multiple times during the day to the patients we're talking about these injections is there's no way to look at your MRI and say, you're going to get this amount of relief, it's going to last this long, or you'll need more than one until we actually do it and see how we do there. So that's why we have the follow-up as we do. Other than that, that's kind of the basic procedure that we do here. There are variances as far as the epidurals are concerned, but the process as far as coming in, getting the injection, and afterwards kind of stays the same for all of those. So this is our recovery area. This is where you will begin and end the journey as far as getting your injection is concerned. My nurse will have come and got you from the waiting room, brought you back into this area here, or we'll have you have a seat here before the procedure. She will go over your consent and that you are who you say you are and the procedure that we're doing. We also get your blood pressure and your heart rate to make sure that is all stable. She'll also go over your medicine list to make sure we have everything correct with that. This is also where you will come after the injection. Usually we'll have you come in here, depending on the procedure, for about 5 or 10 minutes or so, just making sure that you have good feeling in your legs and everything is working the way we want. After the injection, usually we'll have you have a glass of water back here as well. Depending on when your procedure was, you may have not eaten or drank anything for the procedure itself there. Once you're feeling all right, then we will have you go back out and we make sure you have a follow-up for about 2 weeks afterwards. If there is 2 patients in the room, obviously we have the divider of the room there, but we've been trying now in our social distancing times to just have 1 person in here at a time. Usually if there are 2 people, it's just as one is going back for the injection and somebody that has just had their injection. We usually do not have 2 patients waiting here to have an injection while somebody else is already in the room.